What is Mallory Weiss syndrome? It's named after somebody. It means a tear of the blood vessel of the esophagus or the stomach because of a violent vomiting. Typically, patients see the doctor because they will say, I vomited 1 time, 2 times with food or some bowel juice, but the 3rd or the 4th time when I vomited, there was a pool of fresh blood. They are bright red fresh blood. How do we know with Mallory Weiss syndrome? Definitive diagnosis is a gastroscope or endoscope, but they carry a small risk. Certain part of history will give hints that it's Mallory Weiss. Number 1, patient have no other medical problem in the past. They have no history of digestive problem. They are not on any a painkiller or any aspirin, any blood thinner that predispose them to a gastric problem, and they typically have history of vomiting, and the blood in the vomiters are typically not the first time, usually the 3rd or the 4th time. And next thing is that they wouldn't lose a lot of blood, and when we check the blood count, they are typically quite normal. They also don't bleed a lot, and usually when they pass motion, we don't find melena or black color stools. The bleeding is actually self-limiting. The moment they stop vomiting, then normally the bleeding will stop when they go to the hospital. When they come to the hospital, if the history is suggestive of Mallory Weiss syndrome with no risk factor for, say, severe gastric problem, we do not have to routinely do a scope for them. If the blood count is normal, the blood pressure, the heart rate is normal, they stop having vomiting of blood, they don't have black color stools, sometimes we just give them some anti-vomiting medicine, some gastric medicine to drop the gastric acid, and ask them to be careful, don't vomit so hard if possible, and that normally settle. But if we have any suspicion, any doubt that it may not be Mallory Weiss syndrome, it could still be an acid reflux, a peptic ulcer, or even a stomach cancer. They can also present with the vomiting of blood. If we have slight suspicion of these, we'll insist doing a scope. To sum up, if we are comfortable that it is Mallory Weiss syndrome, we don't really need to work very hard to do a scope. We can monitor, treat the vomiting for 1 or 2 days. It's okay, we'll discharge them. But if we have the slightest suspicion of that it may not be Mallory Weiss syndrome, we'll ask the patient to do a scope.